Hello students, welcome to our channel Study Ayurveda with Pro. So today we will be discussing about a very important topic which is called the diagnosis of pregnancy. It's a very common and a very fundamental topic for every doctor, physician, medical student, and detailed knowledge of this topic is very much needed in clinic, academic, in every places for a medical student or a doctor. So today we are going to have a detailed study about the diagnosis of pregnancy. So before going to the depth, first we should know that what is pregnancy. What is pregnancy? Pregnancy is a term used to describe the period in which a fetus develops inside a woman's womb or uterus. Means प्रेगनेंसी इस समय को बोला जाता है जब एक वुमन अपने वोम में एक फीटस को धारण करता है. इस टाइम पीरियड को प्रेगनेंसी पीरियड बोला जाता है. और प्रेगनेंसी यूजुअली लास्ट फॉर 40 वीक्स और जस्ट अबव 9 months. As it is measured from the last menstrual period to the delivery. Means the estimated date of the delivery is measured from the last day of menstruation to the delivery date. In medical science, it is divided into 3 trimesters. So, the first trimester, the second trimester, and the third trimester. So, what is trimester? Trimester are a uniform segments of time or a period of 3 months, especially as a division of the duration of pregnancy. And we can calculate it in week also. Like the first trimester is from 1st to 12th week, second trimester is from 13 to 28th week, and the third trimester is from 29 to 40th week. So now we are going in the depth of the diagnosis of pregnancy thing. So I am taking you to the main note part. The diagnosis of pregnancy. The sign and symptom of pregnancy vary with different period and may be classified under 3 period or trimester, namely the first, second, and the third trimester. Means the sign and symptom of each and every pregnancy is unique and may be different from each one with each other, and the symptoms in each trimester is different from each other. So the first trimester is the week from 1 to 12. So there are several types of symptoms which we see in first, second, and third trimester. So the symptoms are basically divided into 2 types. One is subjective symptom and another is objective symptoms. So subjective symptoms are the symptoms which is faced by all the women. Like it is very subjectified, and the objective signs and symptoms are very objective to and unique in purpose. So subjective symptoms are common in each and every mother. So first is the amenorrhea. Amenorrhea means it is the first symptom of pregnancy. In normal menstruating women, it is not wholly reliable as it may also result from chronic debilitating disease, emotional stress, and other factors. It is considered as a sign of pregnancy until proven otherwise. Means amenorrhea means the arrest of menstruation. The arrest of menstruation means when a woman goes in the menstruation period, or it can be said the absence of period. So absence of period can be the reason of many other things also, except the pregnancy. like chronic diseases, emotional stress, and other environmental factors. But this is a prominent and a very significant sign and symptom of pregnancy. So amenorrhea is a first and very very basic thing about the pregnancy. Second is the morning sickness. It is usually follow a missed period and rarely last beyond 12 weeks. Means in the first trimester, in the initial phase of the pregnancy, morning sickness is a very common thing. Means when the potential mother is awakening from the sleep, she feels drowsy, she feels very weak. So morning sickness is very common and it is very subjectified in every mother. Frequency of micturition, polyuria, that is the frequency of micturition, the frequency of urination increases at that time. Polyuria and polydyspnea due to the aggravated bulky uterus resting over the bladder mucosal congestion, osmoregulatory changes. Beyond 12 weeks, the symptoms disappear but recur again in the third semester due to pressure of the presenting part. Means due to the bulkiness and the weight which rest over the bladder became very congested, and as a result frequent micturition takes place. So with time, gradually this symptom moves away. But again in the third trimester, that is from the 29th to the 40th week, this symptom again comes. This comes because in the third semester the fetus becomes very mature, and as a result this weight of the fetus or the weight of the baby goes in the urinary bladder, which causes the frequent micturition due to the pressure and the congestion of the urinary bladder. Fourth is the breast discomfort, feeling of fullness and pricking sensation, and it is a very basic and a common symptom which is seen in every potential mother in the initial period, like pricking pain or some uneasiness is felt in the breast. Fifth is fatigue, very common in early pregnancy. Fatigue and motion sickness and sometimes drowsiness is very common in the early pregnancy. So here we discuss about the subjective symptom which is found in every mother. Now the objective symptoms, like the first is the breast change, enlargement and engorgement, areola is more pigmented, monogamy tubules and are prominent, thick yellowish secretion, colostrum expressed earliest at 12 weeks. Means the breast becomes enlarged due to the mature of the areola. That's the reason areola is more pigmented, and on the Montgomery tubercles is prominent. Thick uvulous secretion, that is colostrum, is expressed earliest at 12 weeks. The yellow color colostrum which start producing from the very early phase of the second in the terminal period of the first trimester, the colostrum starts to prepare in the mother's breast. Second is the Chadwick sign. It is the dusky hue of a vestibule and anterior vaginal wall at about 8th period of pregnancy due to the vascular congestion. Godel sign, cervix becomes soft as early as 6th week. It feels like lips. Non-pregnant is like the tip of the nose. There is a bluish discoloration. Palmer sign, regular rhythmic uterine contraction can be elicited during the bimanual examination as early as the 4th to 8th week. So these are the several signs which are very objective in the mother. And the seventh is the uterus size. The size of the uterus becomes like a hen's egg in the 6th week, the cricket ball in the 8th week, fetal head in the 12th week. So here is the end of the first trimester, that is the week 1 to 12. Now we are entering into the second trimester, that is the week 13 to the 28th week. So what are the subjective symptoms that every mother faces? First is the amenorrhea continuous, means the arrest or the missing of period is still going on. Nausea, vomiting, and frequency of micturition usually subside. As we earlier discussed, the micturition which generally increased in the first trimester, it gradually grows down, and it is not prominent in the second trimester, but it again comes in the third trimester. Second is the quickening. Perception of active fetal movement, it is felt in the 18 to 20 week in the primitiva and 16 to 18 week in the multigravida. Means the perception of the active fetal movement, like the movements of the fetus and the palpation from the fetus can be felt at that period, that is in the 18 to 20 week. So these are the subjective symptoms in the second trimester, and the objective symptoms of the second trimester are closma. Closma are the pigmented skin. It usually presents a dark brownish patches of skin, mostly on the forehead, nose, upper lips, and cheeks. It's a very, very important and very common thing which is seen in every mother, like 99% mother. Their closma is present. What is closma? Closma is the pigmentation of the skin during pregnancy. All the darkish part of our body become more darkish due to the pigmentation, because in that period a hormone named the melatonin secretion hormone increases. Due to that the pigmentation of the skin increases, and it is mainly seen in the forehead, nose, upper lips, and cheeks. Second is the breast change. Secondary areola is demarcated in primigravidia. Montgomery tubercles and prominent extend up to the second areola. Third is linea nigra. Linea nigra is a very important and a very prominent thing to detect the pregnancy. Is that often referred to as a pregnancy line, is a linear hyperpigmented that commonly appears in the abdomen, extending from the syphilis pubis to ensiform cartilage as early as 20th week. When we will be diagnosing pregnancy and and the examination of a pregnant lady, we will visually see in her abdomen a thin line is created which is extending from the syphilis pubis to ensiform cartilage. If we say in a common language, it is seen from above the umbilicus and extended up to the mons pubis. And sometime in the latter part of the pregnancy, it is seen that some hair like thing is grown beside this linea nigra. And this thing is also hyperpigmented, as already we have discussed. The hyperpigmentation is the result due to the oversecretion of the melatonin secretion hormone. Fourth is the setae. Pink and white setae are visible lower abdomen, flanks, and breast, called setae gradation and setae abrogation respectively. Then the Braxton-Hicks contraction, irregular, infrequent, spasmodic, painless contraction without any effect on dilatation or cervix. Active fetal movement, positive evidence of pregnancy and a live fetus as early as 16th to 18th week. Means the movement and all the attitude of a baby or a fetus can be understood from the external, from its movement in the early 16th to 18th week. Then the FHS, that's a very important thing. FHS is the fetal heart sound. It is the most conclusive evidence or clinical signs of pregnancy detected between the 18th to 20th week. That is when a physician is examining a pregnant lady. A very important and a fatal thing is the fetal heart sound, that can be perceived through the stethoscope. And it is the most important or most prominent evidence that a fetus is present in the abdomen. Bluish discoloration, observed and most evident at vagina, vulva, and cervix. All the area regarding the vagina, vulva and cervix become little bit bluish in color, or it is also called as the bluish discoloration. So it is the end of the second trimester. Now we are entering in the third trimester, which is the week from 29 to 40. First, the subjective symptoms. First is the ammonia persist, enlargement of the abdomen progress, means the arrest of menstruation is still going on, the abdomen enlargement is going on. Lightning, a sense of relief from pressure symptom felt at 38 weeks, especially in primigravida due to the enlargement of the presenting part. Now the subjective signs. Cutaneous changes are more prominent with increased pigmentation and styria. Uterus shape changes from cylindrical to spherical. Throughout the first and the second trimester, the shape of the uterus remains like cylindrical. But now in the third trimester, the shape and size of uterus changes from cylindrical to spherical, and the pigmentation increases gradually. Buttocks his contraction are more evident. The contraction of the fetus in the in the lower abdomen of the mother is more evident and can be perceived more frequently or more in higher frequency. Fetal movement are easily felt. At that period in the third trimester, the fetus becomes more active and more prominent. As a result, the movement of the fetal can be easily felt. Fetal part are palpable, means the palpation of the fetus part started at that position, and we can identify the lie, presentation, position, attitude of that fetus. FHS is distinctly heard, that is the fetal heart sound is distinctly heard, but sometimes it is difficult in obesity, like the mother who is obese and have a layer of fat on her abdomen. In that cases it is difficult to identify. And sometimes in polyhydramnios and OCP position. Polyhydramnios means sometimes the amniotic or the maternal fluid increases in the abdomen. As a result, the fetal heart sound is not that prominent like the regular one. So this is the end of diagnosis in pregnancy. This is the very basic and a very at a glance you can say of the diagnosis of pregnancy. Hope this note and this study material will help you in creating note of pregnancy diagnosis and have a clear-cut view regarding the signs and symptom which can be seen in the first, second and third trimester in a mother. Hope you like the video. If you like the video, press the like button, leave a comment below and subscribe the channel. Thank you. Have a nice day.